Okay, how about now? I'm talking, I wasn't saying anything before. How about now? Hello, hello, hello. I wish I had a radio or something to play. I saw it briefly. No audio. Jesus Christ. Yes, yes, what? I hear you. Okay, great. Can you see it? Because I'm not seeing it. It's got something that wants me to sign on to YouTube, and if I don't have to do it, I'm not going to, as long as it can be seen. It's giving me. I get all kind of different things going on down here. Let's see. Okay, there we go. Okay. All right, as long as it's working, I'm good to go. Thank you, Thomas. Oops. Ooh, it's gonna be a long message.
Okay. All right, so keep your phone on in case you need anything else. Looks like everybody's out. And so we should be good. Oh, what's your name?
Jeffrey.
Jeffrey's over here.
Michelle.
He can set us out.
Yeah.
Yeah, ask Jeffrey because Jeffrey was going to email the help desk if they come live stream.
I got it.
But I didn't get the email until I forward you that PowerPoint presentation.
Mm-hmm.
And so everything else they need a form. And so I'm okay.
I've got it.
Jeffrey's got the form. He hears you. I got you on speaker, so Jeffrey has the form.
Okay. And Jeffrey, can you pull the PowerPoint from Michelle's email?
Or can you email Jeffrey? Which way would be easier? Jeffrey.
I can try to. It would probably be easier if she sent the email to me. You all don't have it on a thumb drive.
You're going to try to do it now?
Okay, I'm gonna go down there on that machine and try to pull it up then.
Okay, so who needs to sign this?
Anyone that's gonna be speaking.
Okay. Okay, so he's already in here, and he's gonna go down there, and if you could forward him that email, then he'll pull up the PowerPoint. Because he's got something set up
This
here
is the
on his-
streaming.
This is the streaming, it's already set up on his laptop, so he's gonna try to have the other one come down in here too, okay?
I'm gonna pull it up on there.
Okay, I am looking for the email. Oh my God, I hate trying to pull up stuff on my phone.
Ooh, where's she at? She's not in her office, huh?
She is at the hospital waiting on grandbaby.
Oh.
Yeah.
Well, congratulations.
Noelle shows up to work and then the phone starts going crazy, right, Noelle?
Yeah. Yeah.
Her due date's not till next week, so she's just a little early.
Yeah, she just started this morning to come today.
That's all right. Today's a good day.
You know, they start the world doing whatever they want.
Okay.
I think we're good, Noelle. I'll call you if I need you, but only if I really, really need you, because I think there's enough of us that we can figure some stuff out.
Okay, and then I was gonna call James to find out what happened to the table.
Don't worry about that table, Noelle. We got, somebody else brought us one, we're good. Don't call him, we're asking, don't worry about that.
Okay.
Don't worry about
Okay,
it.
well, I'm looking for the email now, and so as soon as I...
Michelle, is it in your email?
It's in my email. You want to just sign on to mine? You come and sign
You
on?
wanna come down here and call your email?
She just found it. Straight send it to
Okay.
her. Okay, Noelle, thank you.
Okay.
All right, bye. She gonna call.
Do you mind, will there be a lot of people in here or?
She's thinking maybe about 40, maybe.
So I could take one of the front tables and put the pamphlets in?
Oh,
and
yeah,
everything?
oh, just have
Okay.
your way with this room.
Okay.
We go back out here and make sure our refreshments don't take way too long. Jeffrey, I'll be right back.
What kind of refreshments you get?
Oh, just something the culinary made. I think they look like little cream cheese bites and
Okay.
cookies. Noel wanted to do a fruit tray, and we were like, that's too much to deal with. We're not doing a fruit tray. How are you doing?
How are you?
Doing good.
Sunlight. Yeah. Yeah.
Hi. I'm good. How about yourself?
I'm doing great. It's Friday. That's right. Sun is shining. We woke up this morning.
Woke up, that's the blessed thing. We woke up this morning.
No, that's right.
You all can tell me everything I need to know about Social Security.
We'll go into it. And maybe even more than you want to know.
Just getting your recognition this morning.
Promotion, y'all.
They keep me working to the last minute, and that's my picture. Well, how come the three of us look so damn young? You're an old person. I didn't think you were.
Huh?
You are an old person.
I'm not.
Are you here for the same?
I remember saying,
She's my best friend. I can't be out alone. You know how it is.
that's right, I'm gonna take care of my girl.
You all feel free if you want to come down here and help yourself with any of the information that we brought.
Dan, you're in a hurry.
Oh, wow.
Then you got down here quick.
Hey, I can never be welcome and prepared for this stuff. I'm a little older than you think.
You're not very close.
No, you would be sadly mistaken. All right. They're all different.
Yeah.
Well,
Even if they have that.
where is the PowerPoint? I'm sorry, Kay. Did you sent her a PowerPoint?
I did.
Was it an attachment?
It was an attachment.
I don't think she sent it to me because all I'm seeing is a site to go to that says www.socialsomething.security.gov my account. That's not it.
No.
She didn't send me an attachment.
If we can't get the PowerPoint that I sent to her, that's okay. I'm used to winging it, so we can do that.
Yeah, she was on her phone and she probably didn't know how to attach the attachment
Right,
because it's not here.
yeah, that's okay. If all else fails, we can do it. We can still.
Okay, are you gonna sit right there?
Sure, I'll probably stand up.
Okay.
Do you need me to stand up so you can?
No, you're good.
I move around a little bit when I walk.
Okay.
What are you doing? Little child, what are you doing this to me? Children.
Hey, Virginia, this is a
Bunch of stuff.
Down here.
You guys can show she got a copy of it? Or she could just read it? Oh, well, there you go.
He thought he could get it, but it's not attached. That's Friday, I don't know. I can't see. That's an L up there.
And of course, often in the conferences that set for the state, they don't have anything like this, so there's no way to charge. And of course, you get a charging station at the back of the room, and the telephone station. But I think that a lot of, I'm actually saying, from the idea of having something. This is
We're on the World Wide Web.
It's good to see you.
Thank you so much. I appreciate it. Thank you.
But you got something over for me. Okay, how long you gonna be there? No, I'm what time are you going? Yeah, I'll be around about an hour. What time are you leaving?
Both of you, I miss so much, miss John, really. John sits down and offered me, I really didn't miss him, and you know, we've talked a million times. Yeah.
I just feel very much. Okay, I won't pay. Yeah, that'd be great.
Where's she at?
She's working, she's gotta leave early.
Oh.
Oh, they got your little drinky food. You gotta go get the ice.
Ice is here.
Oh, did they get it?
Yeah, that's actually good.
Okay, good.
Good, man, all right?
They've been in your office.
Hi, Michael.
Yeah.
It's so weird. Hang on, it's seems like a video. Testing. If you don't mind, I'm going to bring the lights a little bit.
That'll be fine.
Screen doesn't kind of wash down. All right, thank you.
As long as I can keep everybody away. Just tell me when to start and I'll.
Okay, I will.
And some of the stuff, it takes a while. That's what I'm talking about.
We can get this party started. Okay, I apologize. Noelle is supposed to, be the hostess for this party, but she got the nerve to be at the hospital waiting on her first grandbaby. So you all, so we should be expecting a baby around 7 o'clock this evening, so she tells me, and she sends her love and says, "Go forth." Thank you.
Thank you.
Thank you.
Is that a sign in?
Yeah, did everybody? Let's see. I'll get one of these for photo release. I'll get a sign-in sheet. Thank you.
All right, well, good afternoon, everybody. My name is Kate Hong, and I'm the Public Affairs Specialist for the state of Kentucky for Social Security. And I brought with me, this is Katie Kennedy. She is a claims representative at Social Security downtown here at 6th and Broadway. Katie takes retirement claims and disability claims, and she's kind of a jack of all trades. So we're both here, and what I'm going to do, we're going to go through the PowerPoint and give you some information. Afterwards, at the end, I'll open it up to any questions that anybody has, and we'd be glad to answer your questions for you. So hopefully today you all will learn something. We're very busy. I'm also at the 6th and Broadway office, and our phones ring off the hook, and we usually get to see about 500 people a day. So for us you all to have us to answer any of your questions without you having to wait in line, that's a really good thing. So just to start off, I wanted to ask, have any of you all gone to our website, the www.socialsecurity.gov? Very good. Anybody in here created their own My Social Security account? Great, great. For those of you who have not created your account, let me tell you about what you can do once you do create it to give you encouragement to look at it. Because before you decide to retire, this is something that is really going to be a great tool for you to use. It's just go to our website, the www.socialsecurity.gov, and on that main page, it says, Create My Social Security Account. It takes about 5 minutes to do it. It asks you some personal questions to verify that it's you. But once you create your account, you get to take a look at your lifetime of earnings. You know how we would mail those out every year? Well, Social Security stopped mailing those out a few years back because of the budget. Now they're starting to mail them again, but they're only doing it every 5 years, starting with 25. So with creating your own account, you can go in and you can look at it anytime you want. And that's really good because before you plan to retire and come in to see one of us or file online, you want to make sure your earnings look correct. You don't want something to all of a sudden jump out when you're ready to retire and say, wait a minute, that says I didn't work in 1980. I have no earnings, but I know I did. And then you have to go and get your W-2s, or you have to contact the IRS to be able to give us proof to put those earnings on your record. So it's good to look at before. Another thing that you can do when you create your account, it gives you how much you'll receive if you decide to take it at 62 years of age, which is the youngest a person can start receiving their Social Security benefits, or if you wait until your full retirement age. So full retirement age right now varies for people. So this is something that you can do, and you can kind of weigh what's best for you. Or what if I waited to 70? At 70, you're able to get even more. You get 8% each year past your full retirement age. So if you haven't created that My Social Security account, do so. It really is a good tool for when you get ready to retire. Okay, Katie? And some of these I'm going to go through. Some we'd be here all day, not, but this is just a little bit of interesting history of Social Security. It started in 1935, and then disability insurance didn't start until 1956. So you can see that there's been some changes, just like the changes with the full retirement age. Used to be everybody's full retirement age was 65. That's when people can start receiving Medicare. That's still the same for Medicare, but it's changed for full retirement age. So the Medicare program didn't start until 1965. So people didn't have medical insurance. You see how long it was before that Medicare kicked in. Okay. And of course, they say Social Security, it is the foundation of a person's retirement. Social Security was created to be 1/3 of a person's retirement benefit. So for what you could live off of when you get, you decide to retire, Social Security was created to be 1/3 of that. And so they say that a person should also have a pension coming from somewhere, a 401k, and then their Social Security. Of course, we know that that's not always the case. Some people, unfortunately, have to live just on their Social Security. And this is just what, that's okay. Yeah, that's just where it shows the foundation, the Social Security, the pension, savings and investment, or other income. You can go through that. That's just kind of, and this is big because we have now baby boomers that are filing. And so we have a lot of people that are becoming retirement age. And right now, it used to be there was 5 to 6 workers for every 1 person drawing benefits. Now we only have 2 workers per person drawing benefits. So see, and this is children, how many people are having children now? It used to be everybody had big families. Nowadays, people aren't having big families, so we're not gonna have as many workers. Okay, 3, I said 2, but it will get to 2. Okay, and that just shows the population's getting older, and there's less people that are gonna be working, paying in. About life expectancy, people are living longer than they used to, so people are drawing benefits longer. And this isn't to scare you, because Social Security is gonna be here. I know people have talked about, is it still gonna be here? Is it gonna, is there gonna be enough money in the system? For us, yes. And you see the changes when Social Security started, where there wasn't Medicare, there wasn't all of that. Social Security has even changed from the time it began to where it is now. And we can't say that there's not going to be some changes, because there will be. Maybe not for us, but for our children or for our grandchildren, there's going to have to be some changes. Just because the population of the United States has changed, and the workforce and all of that, there will be some changes. But for us, we're safe. I think we're going to be able to draw our Social Security and be okay. This is just more facts about, what with inflation and all right, so this is just talking about your retirement benefits when you're ready to file. So in order for a person to receive retirement benefits, persons had to work and pay into Social Security. Is there anybody in here who falls under the Kentucky State Retirement System where they have not paid into Social Security? Good, that's good. Okay, so you work, you pay into Social Security through your payroll taxes, and you have to have 40 quarters of coverage to be able to file for retirement benefits. You earn those credits of coverage with $1,220 in earnings. This is this year, to earn a credit, and you can earn four credits a year. So basically, it's in 10 years, you can earn your 40 quarters of coverage, and you're covered. And this is just telling you that to start thinking about your retirement and how to prepare. So, if you decide to take your retirement benefit at 62 years of age, that's the earliest that a person can receive their benefit. But if you do make that decision, you need to know that there's some limitations. First, if you take it at 62, there's a limit on how much you can earn. And right now, that limit is $15,720 gross, correct? And there's also, if you take it prior to your full retirement age, for every month that you take your benefit, prior to that, there's a permanent reduction in the amount that you're going to receive. So that's why it's important to go on and create your account too, to see what that reduction is going to be if you take it at 62, or you wait until your full retirement age. Right now, people that are filing for their Social Security retirement that are 62 years of age, their full retirement age is 66. So they're taking it, 4 years early, so they're getting hit pretty good. But, they're taking a pretty good reduction. So it's something that you have to think about. Now, once you reach your full retirement age, there is not a limit on how much you can earn. So, say your full retirement age is 66. Once you reach that full retirement age, the day that you turn 66, there is no limit. You can make $1 million, and you're not penalized for it. The year that you turn your full retirement age, that January, say 4 years from now, in 2019, a person's going to reach their full retirement age, and they're going to be 66 in August. That income limit goes up to $41,400. Right, and so a person can make $41,000 from January until August and still be able to receive benefits and it not affect them, they're okay. So in 8 months, they would be okay. It's just that from 62 up into the full retirement age is that $15,720 limit. Now, we're starting to see in our office quite a bit, where you see at 62, you get 75% of your benefit, 66, 100%, which they're saying 66 because that's full retirement age right now. If you were born after 1960, it goes up to 67. But then at 70, look what happens. If a person can wait until 70 years of age, for every year that they put off receiving their Social Security, they add 8%. So a person can actually get 132% of what they paid in if they can wait till 70. But not everybody can do that. All right, so if you decide to file for your retirement and you have minor children, your minor children can receive benefits off of you. So if it's a unmarried, under 18, or under 19 and still in high school, they can draw benefits off of their parent. Or if you have an adult disabled child that was found disabled before they were age 22, they can draw parent benefits off of their parent that's receiving retirement benefits. Your spouse, if they're 62 years of age or older, and they can receive benefits, and they can receive it a little bit earlier if they're caring for a child that's under 16 years of age. So ex-spouses, and a lot of times I have questions about this because people say, "Am I extra off of me? I don't want to." And I ask them, "Were you married for at least 10 years?" Yes. Have you been divorced for at least 2 years? Yes. Well, they sure can. But the thing is, it doesn't affect the person who's worked and paid in. It doesn't affect their benefit at all. So that's the big thing, for them to know. Your spouse or ex-spouse can draw off of you, but it's not going to reduce yours. You know, so that's something. So you have to be married at least 10 years. You have to be 62 years of age or older, divorced at least 2 years. And say, for instance, and this is for spousal benefits across the board. Say that you come into our office and you find out that you're going to receive $2,000 a month. Your spouse is also of age to be able to start receiving benefits and wants to draw, and that spouse finds out that they're only going to draw $500 a month because they haven't worked that much in their life, and they took care of the kids or whatever. Well, we can look at, because what the spouse is receiving at $500 a month is less than half of what their spouse is receiving, that $2,000 a month. We can take an application for that spouse to draw off of their spouse to raise them up to what half would be. So they get $500 off of their own, and then $500 off of their spouse to raise them up to $1,000, to be able to get half of what the person who has worked the most in the marriage. So that's a good thing. That's to help bring them up.
And that,
Sure.
and that does not count against yours when you actually start drawing it like at 70.
It does not.
Right.
It does not. Now, what we do have people, what people are doing right now, some people are coming in, and a person has to be at full retirement age to do this. But they come in and they want to file and suspend benefits. Have you all heard of that at all?
No.
Well, what's happening is people are coming in and they're filing their full retirement age, they're filing and they're suspending their own benefit, so their spouse, who's eligible to draw, can be able to draw that spousal portion, and then that person, by suspending, can wait until 70 and be able to get the full amount, but they're still getting something. The spouse is receiving something in the meantime. We're seeing a lot of that, aren't we, Katie? So the benefit's 50% of the worker's unreduced benefit. And when we say unreduced, that's full retirement age But if a person takes it before full retirement age, there's gonna be a reduction, like I said. Okay? So this just tells you, gives you the breakdown of what your full retirement age is. Can everybody see that?
Go back.
From 43 to 54, if you were born between those years, it's full retirement age 66. And then for every year after that, it goes up by 2 months. And then after 1960, it's 67.
And you can get that on our website too. It'll tell you what your full retirement age is. Yes, ma'am.
Okay, so let's say that, my retirement age, I think is something like 66.9 or something.
Okay,
Okay, let's say I retire at 64,
okay.
then it'll be prorated, right? I mean,
It will be reduced for every month that you take it before your full retirement age. Okay. So this is, basically, people have wondered how we figure out what their monthly benefit's gonna be. So when you look at your lifetime of earnings, you look at your earnings record, we pulled your top 35 years of your earnings. And so that's what it's based upon. And they do an average and they index the monthly earnings, and they throw out the 2 lowest years. Okay? So that's how they figure out how much you're gonna get each month. It's based upon how much you've worked, how much you've paid in, and they choose the top 35 years of your lifetime of earnings. And this just kind of gives you a breakdown to give you an example of how that's done. So if your average monthly earnings are $5,200, then your monthly benefit would be $2,105. And it's kind of hard to understand the formula that they put into it, but that's just how they index it, and they do an average indexing. We also, with Social Security, and people don't know this, is they do index your earnings. So say in 1965, you might have earned $10,000 for that year. Because back in 65, that was a lot of money. But in 2015, it's not a whole lot of money. So they index those earnings to bring it up to the cost of living of today's standard. So the benefit that you're going to receive is off of the indexed earnings. Okay, not off of back in 1960 or 65 when you made $10,000. All right, and this, you can also go to our website and you can, when you create your account, you can also get this estimator. It's kind of fun to play around with. There's a calculator on there to be able to let you know how much you draw. And it's based upon your earnings when you create that account. So, and this just gives you a breakdown of what you can expect if you take it at full retirement age. And I've already talked to you about that, creating your account.
Excuse me? On that last screen, I noticed there were three categories. What is considered low, average, and high earners? Is there a dollar amount there, or is that?
There is, and I'm off the top of my head, I think it's, Katie, do you know what that is off the top of your head, the highest? It's like $188,000 is the maximum of what your Social Security is taxed upon.
Yeah, might even be a little lower.
But, so of the people who are paying, paying into Social Security, the highest earners, this is what it's saying. They're not getting back as much off of what they've paid in compared to somebody who was paying lower.
Like us, for example.
It benefits, that's what it's saying, because it's supposed to be 1/3 and they base that off of an average of what the United States, what a person would need to be able to live in retirement, so.
Thank
You're welcome. All right, right, so, of course, in order to create a social security account, you have to be 18 years of age. You have to have a valid email address, social security number, and a U.S. mailing address. And if any of you all have children or grandchildren that are 18 years of age or older, it's never too early. They need to start planning. I tell my children all the time, you know, most companies don't have retirement benefits anymore. And they're the ones, these young people, 30s, 20s, and, you know, younger, they need to start planning because they're gonna be in big trouble if they don't. So for them to watch their earnings and watch to see, hey, if I, you know, retire at 62, from what the little bit I've worked right now, this is what I'll get. Can I live off that? So it kind of gives them the reality of what they need to do. So kind of spread the word to the young people as well. So, and this just tells you what you can do if you're not receiving benefits from Social Security, if you do create your Social Security account. So you can get the estimates, your estimates on how much you would receive. You can look at your earnings record, that kind of thing. And this just tells you if you do get benefits, if you're already receiving benefits, you can change your address, you can change your direct deposit, those type of things without having to wait in line or get on the phone with us. So it's pretty convenient. And we're not going to go through that. I think everybody in here, it's pretty self-explanatory. You can create your Social Security account by doing it. I wanted to talk a little bit just about Medicare. At 65 years of age, that's when a person files for Medicare, okay? There's Medicare Part A, that's your hospital insurance. Medicare Part A is paid for where you see the Medicare taxes taken out of your payroll check. That's already paid for because we're taking those taxes out of your check. Part A is your hospital insurance, so if you go to the hospital, if you have to take an ambulance ride to the hospital, that's what that Part A is for. So at 65, you want to file for that. There's no charge for it. There's not a monthly premium, but it's hospital insurance. And most of your insurance companies are going to want you to file for it because they're going to want Medicare to be primary and them to be secondary, at least for the hospitalization insurance. Now, there's Medicare Part B, and Medicare Part B is for you to go see the doctor. If you're still working, and still employed and covered under your employer's group health plan, you can opt out of Part B and you're not penalized. So that's something that we see a lot of. There's a lot of people that are still working and they're covered under their employer's health insurance and they say, I don't want Part B yet. Because that's the one where there's a premium. It costs $104.90 a month for Medicare Part B. But if you're retired and you're covered under your employer's health insurance, that is not where you can opt out of Medicare Part B, okay? There's a difference. You can only opt out and not be penalized if you're still working, okay? Not if you're getting retirement and then covered under your employer's insurance. Because once you retire and you're receiving your insurance from your former employer, when you get ready to turn 65, that insurance company is going to send you something, say, go to Social Security and file for your Medicare Part A and B, because they want you to do that. Like I said, they want Medicare to be your primary and them to be your secondary. Medicare is basically, it's an 80-20, Medicare pays 80%, and then you're responsible for 20% of the coverage, and usually if you're covered under an employer's plan with your retirement, that'll pick up that 20%. There's Medicare Part, oh yes, sir.
I turned 65. My wife is going to turn 69 in June.
Okay.
We're both covered under the plan here.
Yes, you did.
I'm going to give it away later.
You look wonderful. You look wonderful. I would have thought you were older.
Everybody looks so good. Neither of us has signed up for Part A. And we don't need Part B. But if we wanted to go ahead and sign up for Part A, can we do that online?
You can, and this pamphlet right here, it tells you how to do
This
it.
one?
The filing for Medicare in 10 minutes, I don't know whether or not, but you can do this online here. Did you
Okay.
get it? Okay,
Yeah,
good.
okay.
You sure can.
And if you do that, then can you say when you want to start paying Part B?
Well, no, now, are you all still working?
Yeah, we're both working.
Yes, what you want to do is 3 months prior to you retiring, 3 months, you want to file for your Medicare Part B. And the reason being, and you can say I want it to be effective 3 months from now, but you want to make sure that you don't have a lapse in coverage from when you retire and you're covered under the employer to where you'd be covered under Medicare Part B. So do it 3 months prior.
Okay, so if, let's assume, and this may not happen, if you retire December 31st, we should 3 months to the day beforehand apply for Medicare Part A
Yes, 3 months prior. You want to do that, you want to file for it.
and Part B. But let me ask you this question. Neither of us will probably in January be drawing Social Security.
Okay.
So how does that get set up so that we get paid, that we pay the Part B when we're not getting Social Security?
I'm going to let Ms. Kennedy handle this because this is what she does for a living too.
All right, thank you.
Okay, so if you are not going to take your retirement benefits and you want your Medicare right now, in December, whenever, what happens is instead of your Medicare Part B premiums being taken out of your Social Security check, Medicare is going to bill you quarterly. It'll be, right now, it's $104.90 per month for most people to get Part B. So they'll send you a bill for about $315 every 3 months.
Okay, so assuming we say that we want it to be effective January 1 of 2016, will we get a quarterly bill in January?
Yes.
Okay. Thank
Okay, what I'm going to do now is I'm just going to talk a little bit briefly about our disability benefits that we have. Social Security has 2 different disability programs. One Social Security disability, that's where you've worked and you've paid in through your payroll taxes. And you've had to work so much and pay in so much to qualify. And the other program we have is SSI, which is an account not to use for a day-to-day basis, but for their future, to be able to have a savings or whatever, so when they retire or for education, it doesn't count against them. Yes, sir.
Those, top earnings you said for 35 years that are used, if you have worked a job where Social Security wasn't taken out, would any of those years be looked at, or would those be excluded? And I guess I'm asking because actually I worked for the city of Chicago for like 10 years, and we didn't, you know, there was nothing taken out.
Are you getting a pension from that job?
Yes, it would be.
All right, those earnings are not going to count towards your Social Security, what that high 35 average is, if you did not pay Social Security tax on those earnings. And in addition, you may be interested in picking up one of the pamphlets down here on the windfall elimination provision. If you're getting a pension from a job where you didn't pay into Social Security, a lot of times your Social Security benefits are going to be offset by that pension. Okay.
How long should it take? I discovered that my Social Security records reflected I earned no income in 1995, when in fact I paid the maximum into Social Security that you could pay in that year. How long does that take to get corrected? Because it's been about 2 months since I took my payroll in, and I haven't gotten any sort of a letter.
You took it into the IRS?
No, I took it into the Social Security office, not your downtown office.
Of your earnings record.
Is payable for a month. If you elect to take it at age 69 and a half, how much will we lose? Is it per month that we lose a percentage?
It's based on two things. There's a percentage and there's also depending upon how much you've paid in and worked and paid, you know. So it could be, is it like I think it's like a 5% each.
Maybe 8%
Quarter.
a year.
Yeah.
With, I mean, if you 8/12.
I can't tell you for sure the exact percentage for each month.
Okay.
But it really depends upon the amount that you're looking at and how much you paid in and then the percentage. It wouldn't be that much though if it was just like, you know, half a year.
Okay, and one clarification, I think our situation would be the reverse. I'll turn 66 in February of next year and entitled to full retirement benefit. But if I needed half of my wife's and postpone mine until age 70 to get the maximum.
Because she's 69,
Yes.
that's a possibility, yes.
Once you're 66, you can do that.
Yeah.
Yeah, well, I would be planning on,
Yeah.
I would plan on, okay, thank you.
For that spousal benefit, the primary has to be full retirement age, or,
Yes.
and the spouse?
No. You're not for the, are you talking about the file and suspend or just to get spousal benefits? No, you don't have to be full retirement age. You
The
can,
primary has to be 62, obviously.
62.
And the spouse has to be 62?
Did you have a question, sir?
I was just wondering if he signed up for the new website, could he see his information inside the website that you say that we can see, all see our information in?
That's true, maybe I can see it online.
You could. You'd be able to see. Thank you. Yeah, there is, and there's a calculator too on there and an estimator that'll base it off of your own personal earnings. You know, so that it would be able to give you exactly.
I have another question.
It automatically, so when you do file for your Social Security, if you want taxes withheld, you need to let us know. We can withhold 7, 10, 15, or 25% of your Social Security benefit for taxes.
Okay, thank you.
Yes, ma'am.
Okay, I have an adult child with a disability who's currently getting Social Security based on her dad's income.
Okay.
Okay. When I retire, would she be eligible, and her Social Security would be higher, she can get mine. So she'd be able to get mine when I retire. But, but if I do it at 62, that's really, she'll be limited, right?
Right. It'll be reduced. It would be a reduced rate.
Within the Social Security website, if you're trying to figure out which drugs you take, which insurance supplemental policy you should take, do you have a calculator or is there one on the internet so that I just put in my prescriptions and it tells me?
There's not. That's a good question because I was talking about Medicare and somewhere I got sidetracked because I wanted to talk about Medicare Part C and Medicare Part D. Medicare Part C, it's a Medicare Advantage. That is a program that you can get into like an HMO, but you're limited. You're limited on the doctors that they say you can go to. You're limited on the hospitals they say you can go to. Some people choose that because it's less expensive. But, so that's Medicare Part C. Medicare Part D is your prescription drug coverage. So just remember D for drugs. What you want to do is once you get Medicare Part A and B, if you're taking prescriptions, you want to call 1-800-MEDICARE. Call them, give them a list of the prescriptions that you're currently taking. And they can match you with a provider. And when I say provider, it could be Blue Cross Blue Shield, it could be Anthem, it could be Humana, United, any of those. You know, and then you would contact that provider that would cover your prescriptions to sign up for the Medicare Part D part for the coverage.
And D can be totally separate from B in terms of
It
provider.
can. It sure can.
And the same question for Part B, the insurance provider, any kind of calculator, any kind of, anything you know that, I can't figure out which policy it is.
Well, when you turn 65, you're gonna be inundated with mail from all these different providers that say, come with me, you know, sign up with me, I need you here, you know, all that. Just, you really do need to do your homework. You need to see who, because what they want, they know you're gonna sign up for Medicare Part A and B. Most people do. But what they're wanting is that you to sign up with them for that supplemental insurance. That's gonna pay that 20%. So that's something where you gotta do your homework and you gotta see what's best for you, who you wanna sign up with. And you may, like I said, you might stay with your employer, if your employer's health insurance, if you're covered under that. That could be who you have for your supplemental insurance. And they might cover your prescriptions where you would sign up for Medicare Part D through that as well. But that's something where you really need to do your homework on the coverage and how much, because it varies with everybody. How much your premium's gonna be for that supplemental, you know, and how much it's gonna be for your Medicare Part D, it varies. So that's where you're gonna have to do your homework. Yes, sir.
And my understanding is that you don't take both Part C and Part D.
Right.
You take one of the two, Part D being more expensive than Part C.
Well, Part C covers, it's like, it covers your B, instead of signing up for Medicare Part B where you can choose your doctors
Right.
and that type of thing, Part C is different, and it's that HMO, but it does cover your prescription drug coverage and all those different things.
So does Part D cover Part B?
No,
Okay,
It's
so
separate.
Part D is separate.
Part D is just for your prescriptions, that's it.
So we would sign up for Part A, Part B, and if we want all the prescriptions covered in Part D.
That's right,
And then we've got full coverage.
that's right.
And we have a broker,
Mhm.
and for two of us, including the 109, or the 104 to the government for two of us, and the Part D, who's gonna run us about 600 a month, is that something?
That we can't say because all we can talk about is what Medicare Part B is gonna cost you. But then it's just completely, that's just the free market out there. So that's where you have to really look at. Yes, sir.
Yeah, there's a JCTC retirement booklet that you might want to contact Noel to get a copy of it, and it covers Medicare, and because, you know, you have to sign up for, I just met with her yesterday, you have to sign up for Part A at 65. When you actually, you know, retire, you sign up for Part D, but KCTCS reimburses you, I think it's $70 of the 107.
Or $104.90.
Yeah, whatever it is. But, so you're really only paying about $37. And according to my notes, she said that KCTCS covers Part D. Part D, the drug. Yeah. So,
KCTCS.
huh?
When you always start KCTCS.
Oh, well, I think UK had it even better.
Yeah.
But you might want to look at that
Yeah,
retirement.
your HR department is definitely
sure.
would be able to give you.
Is that only if you keep working or if you retire?
No, when you retire.
You get that?
Yeah, yeah, which is apparently an unusual benefit, but it's kind of compensating for the low salaries for 35.
Good. Well, let me ask you this question since you met with her yesterday, we still need to meet with her. If it would cover my wife's Part D as the employee, would it, I'm currently covered, I don't pay for my coverage on the year, I wouldn't think it would care. But if it's covered by Part D,
Yeah, Noel knows.
Noel.
Yeah.
All right. Yes, sir.
I'm already drawing my Social Security.
Okay.
But because I've been in the youth retirement for the last 18 years, I don't draw the full amount.
Right.
How much will that drop when I retire? Will it drop again?
No, because now you're working and you're paying in to Social Security, right? Or you're not paying in?
I'm in the teacher's retirement.
Okay. So but you're continuing to work, is that what you're saying?
I'm getting more at this point, I'm drawing, like $500 less than I would if I paid him.
Okay. So are you continuing to pay into Kentucky State Retirement to make it grow? Okay. It could have an effect on it. Because your offset that was done on your Social Security is depending upon your pension amount. So every year, once that's recorded, how much, if your pension goes up, then it's gonna let us know, and it could affect your Social Security.
This doesn't sound fair.
I know, but the reason why, it's hard to understand what happens to people who have worked and they haven't paid into Social Security, but they paid into like a separate retirement system like the Kentucky State Retirement. Because of what I said before, the way they wrote the law with Social Security is supposed to be just 1/3 of what your benefit, so you're supposed to have 2 other thirds to be able to, you know, get you through retirement. If they look to see if your pension is more than what they base the average off of, that a person can survive and be able to receive, then that's where they reduce the Social Security. Because they say you're already receiving, we're not gonna bump you up to more than 1/3 when everybody else is just getting 1/3. It's hard to explain, but I've got this, if you want, did you get one of these? Because this is what it talks about, it kind of tells you about it, and I know it doesn't seem like, we have school teachers, sometimes, of course, you're all, a lot of maybe big teachers as well, I don't know, but, you know, we have teachers come into the office and, oh boy, they're so mad when they find out that they're gonna get that offset, and it's gonna reduce them. But just the way they wrote the law, and for the retirement system to be in the United States of America, is just that 1/3 reduction, you know, it's supposed to be 1/3, so they have that offset. And it does affect people who have worked and they haven't paid into Social Security for some years. You may have paid into Social Security doing other things, but they offset the part where you didn't pay in.
The booklet, she answered the question about what you need to know about Medicare Part B. This is for an employee. Your existing prescription drug coverage, the employee health plan, ADHD, and the KCTCS offered Medicare eligible plan is on average as good or better than the standard Medicare prescription drug coverage, Medicare Part D. You can keep your existing drug prescription coverage and choose not to enroll in the Medicare Part B plan. A notice of credible coverage will be supplied to you. Keep this notice. You will not be penalized if you later decide to enroll in a Medicare prescription drug plan if you have your copy of the notice. However, if you drop your entire group coverage and do not enroll in a Medicare Part B plan after the group coverage ends, you may be penalized if you enroll in a Medicare Part B plan later. And it appears on the cost thing that for the employee, it's $0. Or $37. For the spouse, it's $508.35. I think the marketplace will provide it better.
I think so. Any other questions for us at all?
I just want to mention, my wife is extremely smart. She's trying to figure this thing out every way but quit. We have finally hired someone who has a deep record in Medicare as a consultant. The price is not that much when you consider that you're talking about the rest of your life and you could lose it for a year, the little bit that it's talking about. It's very complicated, and not only the drugs, but the plan itself, go through and look at all the things about you and your life and how you perceive it and what have you. It may be worth spending, I'm telling you, it's $400. It may be worth spending $400. Sound like a lot because we're teachers, but when you look at the long run, we can't figure out what we're doing, and I'm extremely smart. She's a little smarter than I am.
We wouldn't question that at all. Anything else?
What's his name? Don?
All right, well, thank you all very much. If you have any questions, feel free. You can ask Noelle, she has my information. And you can send something to her, and she'll send it to me, and I'd be glad to answer any other questions that you have, okay? Thank you. Sure.
I can't.
I just have my own account now. I did it for my wife too. So I ran off.
Yeah, it's
the report that they send out. They used to send out the green, kind of green report.
So they get access to all your records?
Oh, yeah. It's the same thing as, it's the same thing that we used to get, you know, they mail us once every
Okay, have a good one.
Here's my wife's, here's mine, and yeah, it's the same statement. It's the same statement.
On their website.
Well, the login thing, as soon as she was signed up for my social security, which is very easy to do. Well, you have to, yeah, you just have to give, last 8 years, credit, 8 credit cards. So they,